Hello guys, my name is Juan Carlos Silva Godinez, and today I will talk about two cognitive biases. I will focus on ensurance and confirmation biases, and I will try to explain why this is important for clinical research. I do hope you enjoy my presentation, and let's start! So I will try to make this presentation as interactive as possible. I will need your attention, so please be as careful as possible when you read the slides, okay? Please take a look at the following number sequences. If you realize the numbers are progressing, they are getting bigger, and there is a rule governing this progression. So I'll ask you to guess what is the rule governing these number sequences. So please think carefully. I'll give you 20 seconds to guess. How did it go? Did you get the rule? Let us check if you get the correct rule. So I'm giving you another three number sequences that have the same rule that you have guessed. Can you confirm it? I'll give you 20 seconds to guess. How did it go? Did you get the rule? Could you confirm it? So let's take a look at numbers again. So what if I told you that these numbers also follow the exact same rule as before? Can you confirm it? I'll give you 20 seconds. What happened? Could you apply the rule? If not, do you have any clue why not? So let us take a look at the numbers again. Let me try to explain you what happened. First, I show you six number sequences that went something like this. Then, you may have guessed that the rule was to multiply the first number by 2 and then the second number by 2. Then, I show you a third sequence that went something like this. And then I ask you to apply your rule. And you may have realized that the multiplication rule you previously guessed didn't work. This is because that wasn't the rule. The rule was to get a progressive sequence of positive numbers, one bigger than the preceding one, without rewarding anything else. What I did is that by showing you the first sequences, I ensured you to believe that there was a rule. And then I show you a second set of sequences to confirm your previously guessed rule. However, when showing you the third sequences, you realize that the rule didn't work. And this was because you previously ensured a belief and then confirmed that belief while the belief was wrong. And this led you to misleading results. So let us define what these biases are. Anchoring bias is a cognitive bias that causes us to rely too heavily on the first piece of information we are given about the topic. Thus, when we are given newer information, we interpret it from the reference point, or our anchor, instead of seeing it objectively. You have seen this before, maybe at the supermarket, when they show you a discount price, showing you a higher amount on the tag. You get anchored to the higher price and you tend to believe that the lower price is convenient for you. On the other hand, confirmation bias refers to the situation in which you give a greater weight to information that supports your previous beliefs. This is commonly seen during discussions when you ask someone else that has your same opinion about the topic to support your previous beliefs. Why is this important in clinical research? Let us say you want to test lower glucosil. This is a last generation oral hypoglycemic drug that is latest technology, so it should be a good drug, right? This will be your answer. So, you design your trial, and for this, you select people with high blood glucose levels. Then, you treat them with lower glucosil for 2 weeks and see what happens with their glucose levels. After the treatment, you see that indeed, patients treated with lower glucosil have lower glucose levels. But is this true? Does this prove that the treatment works? Could it be the case that there are alternative explanations to your findings? People with high glucose levels are a selected extreme of the population. Then, you are performing multiple measurements. Thus, could it be that you are observing just a regression to the mean instead of a treatment effect? I do acknowledge that this may be an oversimplification, but you have to always consider that your results are not due to your intervention or your study design, and may be due to something else. The importance of bias relies in that you have to consider that your results are somewhere in between of what it is really happening and what you want to see. This problem is seen not only in clinical research, but in clinical medicine as well. Thus, remember to always consider all the possibilities that can explain what you are observing without only relying on what you expect to see according to your previous beliefs. Remember, valid results of a clinical trial are not only dependent on a complex study design, such as a 3-arm placebo-controlled randomized study, or the use of fancy statistics such as regression methods. The validity of your results depend on that you thoroughly analyze what is happening without expecting the results you want to see and considering all the possible explanations that could lead to the results you observe. Well, I do hope you enjoyed my presentation and you learned a little from it. See you in the workshop. Thank you.